and then I can then put the recording of this session if you want to go back, and also for those who didn't attend. And remember, as a review, if you attended the Zoom session, of course you get automatic attendance. But if you weren't able to attend the Zoom session, please try to get at least a task or your medical language laboratory or a quiz done. And if you missed a quiz or missed something, I sometimes will get a instant message to you or an email to you like, hey, you missed something. But overall, it is the responsibility of the student to know what they'll miss. And then you'll see it. I'll post a 0, and then please go deal with that. So what are we doing this week? And as a quick review, let me open up. As a quick review, what did we learn last week in Chapter 1? We essentially learned that the programmed learning language of medical terminology, let's take the word cardiology. If you take a word like cardiology, let's make this smaller so we can focus. So we look at the word cardiology, of course, it's in parts. So it will look like this in your textbook. And the part that's on the end is always the suffix. The part that is the main part of the word is the root. There are times there's a connecting vowel, and most likely it's an O. And the root plus a connecting vowel O is called the combining form. And if I'm going to make up a word in a second, if there is another section that's in front of the root, and that's called a prefix. So let's say, let's look at the word endocardium, which is a part of the heart. So let's look at the parts. You have your suffix here. We have a root, right? And then we have a connecting vowel. But what's this in front of the root? That is called a prefix. And if we look at this word, means structure of, endo means within, cardi we already know means heart. So that means it's the structure within the heart. And that's also how you read medical terminologies. You start off at the suffix, then go back to the beginning, and then work your way back. Okay, so that's a quick review of what Chapter 1 did for us. What Chapter 2 did for us, it had directions, planes, and also the different sections of your abdomen and the different cavities of your body. Now, I'd like to go over, let me move this down. I'd like to go over let me move this over. If you looked at your textbook and the video, let's look at the what's the worst sections? When you look at this, if you look at the abdominal area, you could use your medical terminology powers, because this one here where there's only 4, that's easy. This is left upper quadrant, right upper quadrant, right lower quadrant, left lower quadrant. That's easy. But remember, you're always looking at the anatomy at the perspective of your patient, not your perspective. So if we're looking at this is my patient's right, and this is my patient's left, right? So you're looking at it, at the perspective of your patient. Now, real quick, what we did last week is another technique on how to study. So if you look at this, it looks like 9 things you have to memorize, but in reality, it's actually 2 things. So you can realize that there's a right and a left, and they're both the same. So that's one group of things. And then you have the middle, which is another group of things. That kind of technique regarding studying is called chunking. It's also the reason why if you're in anatomy and physiology and other classes, they make you do a concept map. It's the reason why they make you do concept maps, because it's training you to look at things in groups, and it's easier to hold it that way in your memory. So if you look at the middle portion, we all have a belly button or our umbilicus, and the umbilical region, al, pertaining to the umbilicus, or when you were connected to mommy at one time, it's right here in the middle. And then right above it, epi, means that is the prefix that means something that's above. So the epigastric region, it's got to be the region what? Above the abdomen. Then the hypogastric region, of course, means the area below. Remember the difference between hyper and hypo? Hyper means too much. Hypo means lower or too little. So if you look at it, this is the umbilical region, epigastric region, and hypogastric region. Now we use hypo again here. Chondr, C-H-O-N-D-R, ac or eac, pertaining to hypo, is underneath the ribs. So right in this area is the area just right underneath our ribs. So that's the hypochondriac area. Then loincloth, right? Where do we wear a loincloth? We wear it around our waist. So that's the lumbar area, AR, pertaining to lumbo, which is loin, which is this area. And the right iliac region, which is the bikini line, and it's part of your ilium, which is part of your hip. So you could see if there's a right, there's got to be a left. So when you're looking at a question like this, or when your future anatomy and physiology classes, this is one way to use your medical terminology powers, so you're not memorizing things, and you know where they are. And certain diseases have certain certain kinds of pain in certain kind of area. For example, the lumbar region, both right and left, there's a kind of pain that happens there. It's called flank pain, and that's indicative of a kidney problem. If you have a kidney problem, it doesn't hurt in your back. It hurts in your loin here on the sides, and that's called your flank pain. And another word for flank is your lateral, or your pertaining to your sides. So that was last week, chapter 1 and chapter 2. And remember, every week is 10%, and every week you have to do the medical language laboratory. And thank you for all who've done these. And again, these practice are optional, but you know what? Do them, because they're relatively easy to do. And again, the more practice, the better. Of course, after that, make sure to do your quizzes. You click here, and they're very easy. They're very straightforward. Also, I failed to mention that, let's say you got an 80 or a 70 on the quiz. Take it again, and then do what? Just ace it. Just keep on taking it until you get 100. And why do we do that? We do that because we have to look at this medical terminology class as more of training and less of being a class. If you start looking at your undergraduate classes in this manner, this will help you retain the information better, because anyone can get a straight ace, in my opinion. Just do exactly what the teacher wants, but we have to look further than that. The function of why we're in school is not to get straight A's. Of course, you have to pass and have to have a high enough GPA to get to where you're going. But the real purpose is to get these things in your head, so when you're working in the field, you can figure out problems on your own, and you can apply what you learned. And of course, the discussion forum, and every time someone answers the discussion forum, I answer back, and I also confirm that I've received it. So if you didn't see anything back from me, shoot me a call, either email or whatnot, because I need to know that you always need feedback, and I don't know why it keeps on removing my instructor stuff here. Maybe it's here in the main page. Yep, there. So here's my stuff. There's me Zoom meeting number and my email and my text, and you could text me like someone's doing right now, right? And I answer everything within 24 hours. And if I don't, hit me up again. Now let's look at Module 2, which is what we're doing this week. And that's cardiovascular. So let's look at that word, cardiovascular. And of course, you have your medical language laboratory, your quiz, and your discussion forum for this week, which I'll put something. Did I put something in yet? Nope, I'll put something in after this session is over. All right, so you can check that in. And of course, all of this is due next Monday, which is, I believe, June 8, June 7. I got to check my calendar. Today's June 1, so it's probably June 7 or 8, something like that. But just know, you get this stuff done early so that you can get to do more exercise, you get to practice more, and that's better. So let's look at the cardiovascular. Let's look at that word, cardiovascular. So I break it down, cardio, vascu, AR. So AR is the suffix that means pertaining to. Now, in this case, you have a separating or a connecting vowel here that's connecting two roots. We already know what cardi means, it means heart, but what does vasculature mean? And the vasculature is what I like to call all the pipes. So that's your arteries, veins, and capillaries. Now, typically your arteries are colored red in your textbooks, and they're not red in real life. And veins are colored blue. They're not blue in real life. And capillaries are like a mix of red and blue. And what does it really mean is the arteries typically have red blood cells in it. So they're the pipes, they're the tubing that connects the heart all throughout your entire cardiovascular system. And the arteries take blood away from the heart, veins take blood towards the heart, and the capillaries connect the two. And an artery typically is oxygenated, and it has the red blood cells in the arteries typically carry oxygen, and the red blood cells in veins typically carry carbon dioxide, which is the waste. Oxygen is like the fuel, and carbon dioxide is our waste. And then the capillaries is where the gas exchange, or we exchange the good stuff for the bad stuff. So the good stuff is the oxygen, the bad stuff is the carbon dioxide, and that's what we have to get rid of. So someone who is a cardiovascular surgeon, they're not only good at the heart, they're also good at the pipes or all these tubings. And another word for vasculature, another word for the pipes or the tubings is, they call it, my mind is, I'll remember it in a second. But you got to think of it as transport system that will bring blood from one place to another, and hence that's why you have the heart, and that's why it pumps. Oh, the word I'm looking for is blood vessels. So these pipes, these are blood vessels. So in a way, what does a vessel do? It carries something from one place to another. And the one thing that the arteries, veins, and capillaries are carrying is blood. And the thing that carries all this oxygen and carbon dioxide and proteins and minerals and sugar is your red blood cell. And you'll learn that in greater detail for your cardiovascular section when you're in anatomy and physiology. So let me minimize this, and then let's now jump to the chapter. So I go into my medical language laboratory. And if I don't want to get into my class and I just want to go right into my ebook, I can just click on ebook right there. And then, of course, your table of contents here on the side. And then I'm going to find the chapter. Oopsies. I'm going to find a chapter on, accept cookies. I have to do that. Let me expand this a little. Respiratory system. And we're going to cardiovascular, which is probably chapter 4. Let me try to, I expand this a little bit further. There it is. Cardiovascular and lymphatic system. Now, the cardiovascular system I already overviewed. Now, what's the lymphatic system? Deals with lymph. Lymph fluid has white blood cells, and the lymph fluid is for immunologic purposes, because your white blood cell is your protector against, you know, pathogens or things that make you sick. So it makes sense that the tubing also, well, let me show you here, Microsoft, the tubing that we talked about also deals with the lymphatic system. Ick pertaining to lymph, and lymph is the fluid that has WBC or white blood cells, and it has an immunologic function. Ick pertaining to, logic meaning pertaining to the study of your immune system. What keeps, and it makes sense. Because if, let's say, for example, you have an infection in your big toe, you need the vascular system and the lymphatic system to pump that fluid to the area where you need your white blood cells. So let's look at, why are we in chapter 5? So I clicked on that, and it brought us here, and then I'm going to put this up. So again, because when you open up, before you start reading, unless you want to fall asleep, you can read the stuff from front to back, but please don't do that. You'll just fall asleep. The best thing to do is ask yourself, what are my objectives? What do I need to know? So the first thing is, who are the people in your neighborhood? Cardiologist, vascular surgeon, immunologist. Who are these people? Identify the structures, right? Now, we're not in an anatomy class, but it's nice because a lot of the structures and a lot of the words will pertain. So it's really nice that the your medical terminology class really backs up your anatomy and physiology classes. What is the functions? Just a little bit. Some of the conditions or some of the pathologies, but really important is these word building skills, which we're about to describe momentarily. Okay, and of course, common abbreviations. Now, JCO, the Joint Commission on the Accreditation of Hospital Organizations, also known as the Commission, they kind of frown on utilizing abbreviations, because in many places it gets abused. But if you see your electronic medical records, many times they use it for expediency, and definitely doctors and nurses all around the world still use a lot of abbreviations in prescribing medications and doing formal prescriptions. So you got to know those abbreviations, okay? And how to pronounce and define them. That's the function of the medical language laboratory part, you know, when you speak in the microphone and that kind of thing. But ultimately, it's practice, practice, practice. And you can see here, wherever there's an artery and a vein, remember, the veins were colored blue, the arteries will be colored red. Blue is deoxygenated or carrying carbon dioxide, or the majority of the gases in that tube is carbon dioxide. And for red, like in this lovely aorta here, which is a very large artery, it's the largest artery in your body. So your aorta here is red because it's oxygenated. All of the red blood cells, almost all of the red blood cells in an oxygenated vessel will have oxygen in it. And you see this yellow here. They're not colored yellow in real life, but they're yellow and green. Yellow is to denote fat, and green is to denote lymphatic system. And you can see how the lymphatic system is inherently connected to the vascular system. And another function of your lymphatic system is to either take away or put in extra water when needed into the system. So again, here's capillaries. They're in between arteries and veins. So that's where the gas exchange would happen, right? So if you go to a specific organ, let's say, for example, your brain will have an artery, right? and then it will take in all the oxygen. But the brain uses up the oxygen and has to do what? It has to let go of carbon dioxide. So it has to get rid of the garbage some way, and they do that through veins. Okay, and on capillaries, you could see they're much thinner than arteries and veins, and it makes sense. That's where gas exchange would occur. The main bulk of any of your chapters are these word element sections in your textbook. And you can see they do a lovely job of breaking it down for you and then giving you examples using combining forms, suffixes, and whatever parts that, that we talked about in chapter 1. So let's look at this one, angiography. Angio means vessel or blood vessel. Graphy, and remember Y is a process of recording. So it's a process of recording your blood vessels. And we do a lot of angiography for, let's say, for example, you had a heart attack. We want to know where exactly was the blockage of which coronal artery, and angiography will tell us that. An aneurysm. Now, I'm going to define an aneurysm first before I define aneurysmography or aneurysmography. Okay, potato, right? So the aneurysm is a widening of a blood vessel. Let me see if I think there's a picture of it later in your textbook, but let me show you a picture here so you know what we're talking about. Oh, right here. Here's an artery, here's a regular artery, and here is an aneurysm. Now, what's an aneurysm? An aneurysm is when the blood vessel gets weak and then the walls start, like artery is under high pressure, and then the walls start like dilating like that. And when it dilates like that, it might explode, and that's never a good thing. So one of the things that we have to do is, Rafi, we have to suture it down so it doesn't explode. One way to look at it is if you've ever looked at an old like garden hose. If you look at an old garden hose, it is what do you call that? The old garden hose. If you look at the bad parts that are you know where the top part of the skin is broken, do you see it like it bubbles up just like an aneurysm? So you could see where aneurysms are dangerous, especially if it's in a big artery like your aorta. If you had an aortic aneurysm, a good friend of mine died of one last year. This is how fast it is. 1 minute she was like, "Oh, I'm just going to go to the bathroom for a minute," and then the next minute she's already deceased because it's such a large artery. If it bursts, it will empty out all your blood, and blood won't go where it needs to go, and then your brain and all the other systems shut down very, very quickly. And she was only in the bathroom, according to a coworker, not even 5 minutes, and she was done. And she was kind of young, fortunately. Aorta, we already talked about. Aorta is your largest artery in your body, and sometimes it gets narrow for whatever reason, or there's stricture. So aortic stenosis, that's also the exact opposite. That's not a good thing to have. Artery, of course, arteriole, arteriole, arteriosclerosis. Now, sclerosis means hardening. Osis means abnormal condition. So it's an abnormal condition of hardening. And it's very easy to do that. Just drink a lot of alcohol, just eat a lot of really fatty foods and not take care of yourself. It's easy to get arteriosclerosis. Arteriole. If we add OLE as a suffix to the word arterio, this artery, right, if is a tube, but if we add OLE to the word artery and ULE to the word vein, let's give those examples right now. I make a normal-sized artery very small by calling it now an arteriole. I make a normal-sized vein very small by making it a venule. So OLE and the ULE, that makes the tube very small. And when I mean small, small in size, not in length, but small in diameter. Atheroma. Remember we talked about sclerosis? The beginning parts, right before things get hard, and hardening your arteries, you get fatty plaques. This is not good either. Again, you eat a lot of nachos. This weekend was great weather. I ate a lot of horrible fatty food. So if I don't do something about it, right, control my diet, control my exercise, what will happen to the inside of my blood vessels? They get these fatty plaques, and oma just means tumor. Remember from lecture 1, tumor means lump or bump. It doesn't mean, in medical terms, it doesn't mean cancer. It just means lump or bump. But if I add a cancer, right? So an atheroma is just a lump or bump of fat. But if I have carcinoma, that's a lump or bump of cancer. Atrium, that's one of the smaller rooms or cavities inside your heart, and your ventricles are your larger ones. So if you have a valve called your atrioventricular valve, then it has to be the valve in between your atrium and your ventricle. And let's look at the cross section of the heart so we can see what that means. Why can't they let me? I just want to see a picture. Okay. See these valves? This is your atrium right here. They're the smaller rooms or cavities within your heart. See this big thing here? These are your ventricles. So your AV valve has to be the what? The valve that's in between your atrium and your ventricles. And the right AV valve is called your tricuspid. The left AV valve is called your mitral valve, also known as your bicuspid, because there's two. Bi means two. Cusps or leaves or leaflets or doors. And this one has 1, 2, 3 doors. So that's got to be the tricuspid. That's a little preview for your anatomy and physiology. Cardiac is heart. So cardiomegaly. Megaly, remember why? Process of being mega. Now, you don't want your heart to be big. Everything in your body has an optimal size. And if you look at where your heart is situated, it's already in a tight, cramped space. So you want it to be a normal size. But the heart is a muscle. And if you make the muscle work too hard, okay, meaning you clog up your vessels and you have high blood pressure and then you never work out. So your heart is not used to doing any work. So what's going to happen? It's going to get abnormally large, and you'll have things like left ventricular hypertrophy and right ventricular hypertrophy. Let's look at that word. Ventricular hypertrophy. Hyper, we already know that prefix means too much. Trophy, process of growth. So it means what? Too much growth. And if I have ventricular left ventricular hypertrophy, LVH, what happened to the left side of my ventricles on my heart? It's too big. And if it's too big, it's going to be a problem. Intraventricular, that means within the ventricles. Vasculature or vascular or blood vessels, we already know that. Vaso, that means blood vessels. Now, the vas deferens is another part of your male reproductive system, and we're going to talk about that later in the term. But for right now, vaso means blood vessel, and if you have a vasospasm, that means the muscle surrounding your blood vessel, your artery, starts squeezing, and that's not good because then it'll raise your blood pressure. That's never good. Now, varicosities or varicose veins. The one thing about veins is that they have these valves that prevent backflow. But what happens to these valves when they get backed up? Well, you get stuff like, see the valves? Normally, blood flows only one way. And then the valves, this valve right here, there's a valve here in the vein, and it's colored blue. If the valves start to fail, what happens? some of the blood starts backing up and it becomes painful, it becomes torturous. And you've maybe seen them on older patients or older family members. They have these blood vessels on, especially on their legs, especially if they're a person like myself who teaches and stands all day. Here you go. See that? That's what happens. And then you get claudications. It starts to become painful. Okay. Ventricles, we already talked about that. Tachycardia, bradycardia. Okay. Now we're doing the suffixes. So cardia means pertaining, or ia means pertaining to the heart. But when we talk about cardia, we're especially with the word tachy and brady in front of it, it means tachycardia. Ia is state or condition of the heart. Tachy means fast. And brady, if I put bradycardia, state or condition of slow heart. Now, when you have something that's, that's opposites, memorize one like your life depended on it, and the other one is simply the other. Because then what happens in an exam when you're nervous or when you're in a hurry, you're going to switch the two. Me, I remember that this is what I've like for 30 some odd years. I remember that tacky, if something's tacky, it goes out of fashion fast. And then that's how I always remember tachycardia is tachycardia. Gram, electrocardiogram, also known as your ECG. Sometimes you'll see it called EKG because the inventors of the electrocardiogram were Germans, and the German word for cardio has a K in it. Now, look at the difference between gram, graph, and graphy. So electrocardiogram is the actual recording. Electrocardiograph is the actual machine or instrument for recording. And electrocardiography, remember why, process of, it's the actual process. So when you're calling for a schedule, it's a minor point, but it also shows who has education. You're like, hi, good morning. My name is Nelson. I'm calling from Dr. Cassidy's office. I would like to schedule electrocardiography. Or if I want to call Central Records, hi, he goes, is there a way that I can obtain a copy of the electrocardiogram? But how many times I'd like to schedule an electrocardiograph? It's obvious that somebody's didn't study or somebody doesn't know how to speak true medical terminology. Okay, so remember the process of recording, that's the thing that you want to schedule, electrocardiography. The actual recording, the actual printout, the actual video, because nowadays electrocardiograms, in the old days we used to put them on paper and you cut them up and then you put the stickers on it. Nowadays you can easily email it to the physician or to the patient, and it gets emailed in an MP4 format, and you could actually see it in real time. It's kind of cool. We already went to something that's we didn't go to stenosis. We went to sclerosis. Sclerosis is the hardening, but stenosis is when all the fat and all the garbage that's in there start to make the lumen of, and the lumen is like what's inside the tube of the artery. It starts to narrow, and if it narrows, that's how you get high blood pressure. And high blood pressure is never good for anybody. We all know that. And endocardium, we already went over that word. Okay. All righty. We're trucking. We're moving on. The rest of this is just practice for all those words. This is a beautiful pick for when you're in anatomy and physiology. But again, we're in medical terminology. We're not in anatomy and physiology. Other schools use this. Hey, what's going on with my screen? Okay, cool. Right, you could see here what I just did. You could click on the boxes so you can try to answer it. And this is a good way to quiz yourself. And then, but the thing is, you might have to record your screen because once you reset, the textbook doesn't record your answers. So, you can record your screen, and there's multiple ways to do that. And if you want to know how to do that, shoot me a call. or an email, and I'll show you. And here's heart, and we already talked about how the veins are colored blue, as in this superior vena cava, inferior vena cava, and how your arteries are colored red. And we already talked about the valves here. These are your AV valves, or your atrioventricular valves. And we already talked about these are your atrium, period. You know, if there's only one we're talking about, and your ventricle, which is this big thing down here. Okay. And that's a really neat practice for your anatomy and physiology for future reference. But for now, we're focusing on the words. Okay, here's another, there's the varicose veins I was telling you about. Normally, for a relatively young person, blood flow only goes one way, and the valves prevent blood flow from going back. Well, when you get varicose veins, these valves start to fail. And that's why you see a lot of more elderly people wear pressure stockings, so it pushes it up. You'll learn more about this. This is an example of an electrocardiogram, right? If you look at the word, we're looking at the electricity of the heart. And your heart actually has an electrical system, an electrical wiring. And it matches up to your EKG or ECG read. Oopsies, no. Okay. And look here. This is an example of an atheroma, a fatty plaque. And if you have an atheroma, it could get sclerotic and start hardening, or you can get this restricted blood flow or narrowing, and that is called stenosis. And if you have that, especially here on your left anterior descending, you're going to have a myocardial infarction. Let's look at that word. And you see how the textbook colored it dark? Because now this area is not getting any oxygen because the artery, or this coronal artery, got blocked, and then we have a problem. So let's look at that word before we proceed. Myocardial infarction, sometimes called an AMI for acute. And acute means it happened right now. Happened, and myocardial infarction. Now, infarction means blockage. So let's blockage of what? Al, pertaining to muscle, and cardi, heart. So your heart muscle got the coronal artery here got blocked, and now the heart muscle here is blocked as well. There's no oxygen getting to it, and this is what is commonly known as a heart attack. Now, the same exact thing can happen in your brain, and that's called the CVA, right? So if we get, I'm going to erase this part so you can see. So AMI, acute myocardial infarction, that's a heart attack. A CVA is a cerebral vascular accident. It's like, it's all, sometimes they call it, it's a stroke, of course. Sometimes there's even, laypersons even call it a brain attack, because it's the same thing. You have an infarction inside your brain, AL, pertaining to cerebrum, which is a part of your brain. And what happened? There's a vascular accident pertaining to the blood vessel. The blood vessel got blocked, no oxygen goes to the brain, therefore you get a stroke. Okay, so those are two very common pathologies, two very common abbreviations that you will that you will see in medical. Oh, here's a CVA. See, if I have some plaque here, a lot of fatty plaque, and it'll block one of these vessels here, then a part of my brain, you see how it all got all gray, won't get it, and then that's a CVA, and that's bad news. Here is another example of an aneurysm. You could see the wall here on this blood vessel, this artery got damaged, and then there's an outpocketing because this is artery and it's under high pressure. Okay, now we're going to switch gears, and now we're going to talk about the lymphatic system, which is part of the immune system. It's the tubing that carries the lymph fluid, and within this lymph fluid is the white blood cell, which helps us with our immune system that defends us against any pathogen. Let's look at that word, because I've used that word 3 times already in this particular lecture. Pathogen. Anything that Gen means creation or generates. Generates what? Disease. Anything that creates disease. Now, don't you think we also have things that create immune system? Yeah. I have good food, good diet, good exercise. Those are immunogens. Those are things that create what? Immunity. Okay. So let's look. Adeno means gland. So if I have an adenopathy, pathy, process of disease, disease in my gland. And a gland is just a structure in your body that secretes hormones. And hormones are chemical messengers in your body. So you can have an adenopathy. Agglutination, that means clumping or gluing together. Now, let's just show it because it's better. We are all better visual learners. So we're looking at agglutination. That means the antibodies and whatever the antibodies are attacking, they get together and then they form these clumps. See here? So this is what happens when somewhere in the middle of this is something like a pathogen, right? And all our antibodies start attacking it and start surrounding it. And then it gets the clumping or gluing, hence the term agglutination. Okay. Immunogen we went over. Lymphopoiesis. Poiesis is the process or formation of. So formation of lymph fluid is lymphopoiesis. Can you also have hematopoiesis? Let's write that word. That's creation of blood, right? Or formation of blood. The suffix here, poiesis, formation, hemat, blood. And now that you learned a whole bunch of other words, don't you think you can combine them even though you've never seen them before? So the Department of Hematology, you now know what it is. Study of blood. The person who's the MD who's gonna take care of your blood and analyze and look at your blood, that's the hematologist. Okay. So you could see how you could start building your own words. Lymph angio means blood lymph vessel, right? And that's combining 2/3. So a lymphangioma, my patient has a tumor, a lump or bump in their lymph vessel, and we have to investigate it because it could be what? It could be a carcinoma, could be cancer. Phagio, phagocyte or phagocyte, right? Phagio means, or phago means swallowing or eating. So a phagocyte is a white blood cell that eats. And it eats bacteria or foreign body. Thymus, of course. The thymus is located, it is a gland. It has to do a lot with your immune system, especially when you're a baby and you're a fetus inside mommy. You could also have a tumor there, and then we'd also have to inspect that. And the thymus is located in your neck. Now, let's look at this word anaphylaxis. Now, Anna from this textbook, it says against or up, but I like parts, because if you look at the word anatomy, tomi, to cut into parts. Analysis, lysis means breakdown, ana means parts. So actually, I got that word from an older edition of this particular textbook. So I find it curious why they changed it. Now, what's phylaxis, right? Phylaxis means protection. So if we look at the word anaphylaxis, means protection against parts or parts of your body. Now, what anaphylaxis is an extreme allergic reaction or an extreme immunologic response to a minor stimulus. So if you're severely allergic to something like a shellfish, I'm allergic to shellfish, like stuff like lobster and crabs. but I love lobster and crabs. Well, one time I totally forgot to bring an EpiPen. I forgot to bring even some Benadryl, and I was at a meeting, and we were getting some free food. So what happened? Everything started puffing up. Everything started forming inflammation. First, my left eye closed. Then my upper respiratory tract got really, really sticky and wet. I started sniffling, and then my throat got really itchy. And then the horrific part is my lungs and my trachea started closing up. And that anaphylaxis is an emergency situation, and you need an epinephrine pen or an EpiPen available immediately to counteract the severe immune response. Another word that's really common as well, you'll see this word prophylaxis, and the prefix pro means before, so it means protection before. What does that mean? Now, when we give you prophylactic medication, especially before surgery, I know that cutting you open, you are going to get an infection. So I give you antibiotics before I even cut you open in surgery, and that's called prophylaxis. Another term for prophylaxis that is common is condoms and any devices that prevent pregnancy, because you want protection against the pregnancy or against the patient getting pregnant before, not after. So anaphylaxis, prophylaxis, they are very common medical terms, and they utilize this particular suffix, and it means protection. Righty, let's go down, agglutination. And you can see here, you see all her lymph nodes and her lymph vessels are all colored in green. They're not green in real life, but they're just, you could see how they're easily associated with your arteries, veins, and capillaries. And it makes sense because wherever you have arteries, veins, and capillaries, there could be an infection. So you want to have a road leading to the infection. And see these lymph nodes? That's what the doctor does when the doctor starts feeling or palpating your neck and then your armpits and in your abdomen and your inguinal area here. That's the reason, when you get all ticklish, well, at least the pediatric patients get ticklish. That's the reason why the doctor is feeling that. Because, for example, if you have next time you have a sore throat or maybe you have a little cold, feel your neck. You're going to feel these little bumps there. And definitely, if you're doing your breast self-examination, do not forget to palpate or feel around your armpits, okay? Because in your axillary area, which is your armpit, you also have axillary lymph nodes. And remember, the lymph nodes get big every time there's a pathogen or cancer in the area, okay? Lymphedema. Edema is just swelling, and it could be for a number of reasons. And that's called pedal edema, because al pertaining to your peds, your feet or your legs. Let's get to the abbreviations. Now, I'm just going to point out the abbreviations that are most common. Not all of these are common, in my opinion, but the ones that you really need to know, and that's the ones I'm going to put out. ACE or ACE inhibitors, that's a very common drug. You need to know that. AED, automated external defibrillator. That's that machine that, when the doctor goes clear and they zap you full of electricity. It's to kind of jumpstart your heart. That's the most layperson way I could say it. But your anatomy and physiology will explain it much, much better. AICD, not so much. AIDS and HIV, very common. Acquired immune deficiency syndrome. AV, we talked about, atrioventricular. Bone marrow transplant, BMT. BP, blood pressure. Yep, they're good. Now, CA, cardiac arrest, chronological age. In my world, CA, capital C, capital A means carcinoma. I I've never seen it used for these other things. Cabbage is also very popular. Coronary artery bypass graft. Now, if you look at the heart, all the arteries and veins surrounding the heart and feeding the heart are called your coronary arteries. Now, what happens when there's a blockage here? Let's say there's a blockage here. What we do is we bypass it. So let's say this part of the heart, if this gets blocked, this part of the heart won't get any blood. So what do? We cut this off, and then we put another artery here, and it bypasses the problem, and then it can feed the area that doesn't have any oxygen. And that's called cabbage, coronary artery bypass graft. These are your coronary arteries, the arteries that, and here's another example of it. These are all the arteries that surround your heart. Coronary arteries, they're special because those are the arteries that feed your heart itself. And that's the location of heart attacks. When these things get blocked, then you'll have an MI, myocardial infarction. What else is good? CAD, coronary artery disease. CBC, complete blood count. You'll learn that in your laboratory classes, what the CBC entails. But there's 3 types of blood, and of course your plasma, which is the fluid part of your blood. And that's your red blood cell, white blood cell, and platelets. So the CBC has a complete count of all 3 of those things, and some other stuff. CC, I don't look at it as cardiac catheterization. It's the chief complaint. CC is your chief complaint of your patient. What was the reason why they came in today? CHB, complete heart block, and not used so much. CHF, congestive heart failure. That's used a lot. Now, remember, your heart and your lungs are cousins. They work together. So if there's a problem with your lungs, you're going to have a problem with the right side of your heart. And that's called right-sided heart failure, or CHF, congestive heart failure. So when they start talking about, oh, my patient has CHF, that means they have a problem with not only their heart, particularly the right side, which is CHF and right-sided heart failure. There's another term they have in cardiology called corpulmonale. Corpulmonale, right, means that it's right-sided heart failure and indicative of CHF or congestive heart failure. CTL, never seen that before in my life. CV, cardiovascular. CVA, we already went to. DVT, deep venous thrombosis. Okay, this is the reason if any of you were either pregnant or knew somebody who's pregnant, it's the reason why we make you walk right after you delivered your baby. Not to be cruel, but in order to increase your blood flow so there won't be thrombosis or clotting, abnormal clotting. And we now know if I have an abnormal clot, can I get a CVA? Can I have a myocardial infarction? Yep. EBV, Epstein-Barr virus, very, very common. Everyone has it, but again, you will learn about viruses and why people get sick and why some people get sick, some people don't. EKG, ECG, that's electrocardiogram or electrocardiography. We already went through that. HDL and LDL, high density lipoprotein. Like, remember I told you that the red blood cells carry stuff? Well, they're not the only things that carry things in your body. There are HDLs and LDLs carry cholesterol. So your HDL, we like HDLs because it carries cholesterol out of my body. LDL carries cholesterol into my body. So we want to keep the HDL nice and high and the LDL nice and low. And the only way to do that is exercise and proper diet. Heart failure, very common. HIV, common. Now, hypertension, sometimes it's lowercase HPN, uppercase HTN, uppercase HPN. There's all different, but hypertension is hypertension. IAS, ICD, and not as common. Inferior vena cava, superior vena cava, IVC, and SVC, that's common. TIA down here, transient ischemic attack. That is a baby stroke. Many patients, right before they get a big stroke, years prior, they get a TIA that kind of looks like a stroke, but isn't quite meet the criteria. And it's transient. It only happened really quick. So if anybody you know got diagnosed with a TIA, I hope they took that serious. My father-in-law, I diagnosed TIA in him. He had a massive stroke 4 years later after it, because of course didn't listen and didn't take care of himself. All right, so those are the more common ones. The other ones, not so much. But again, knowing your abbreviations can help you. Angina pectoris. Let's look at some diseases and conditions, and then wrap it up for today. Angina pectoris is it's chest pain. It can be mild, it can be moderate, it can be severe, and it's chest pain for when the patient did something strenuous, like they walked up the stairs or lift something. It's usually doing exercise, and then they start complaining about chest pain. Brewy, nice to know. DVT, we already went through. An embolus, ooh, that's important. Embolus. Now, an embolus is when a thrombus or let's put the difference between a thrombus and an embolus. Now, a thrombus, us means structure of, and throm means clot. So if my patient has thrombosis, not good. They have an abnormal condition of clotting. So that means they're clotting either too much or too little. If it's too much, then we get CVA, we get myocardial infarction. If it's too little, they get a bleeding diathesis and then they bleed out. Now, what's an embolus? Now, the thrombus or the clot, it usually stays in one place, right? And then does damage there. An embolus is bad news. It's when that clot breaks off and then travels elsewhere. And hence, when we try to prevent mommy from deep venous thrombosis, when you're walking and when you're moving around, you increase your blood flow, and your muscles start churning out blood, and then it moves everything around. So it prevents thrombus, it prevents an embolus. Heart blocks, you learn. Heart failure, you learn later. Hypertension, of course, now let's look at this word, ischemia. It's a little tricky, that word. Emia means blood condition. Ia is means condition. Em is short for heme or iron, which deals with blood. Now, isch means blockage. So it actually means blood condition of blockage, or even partial blockage. Let me open this up so you can read it. Okay? So that's what ischemia is. And that's not good, because then it leads to things, right? MI. So that's ischemia. So it's like a deficiency of blood flow. And then your patient's going to have some signs and symptoms, and it's in the best interest to tackle that. MI, PDA, patent ductus arteriosus, is not that common. RHD, rheumatic heart disease, not that common. AIDS, lymphoma, we already talked about that. OMA, potential tumor. Lymph, in my lymph vessels or lymph fluid. You have two types, Hodgkin's and non-Hodgkin's, and they are definitely cancer. Then you also have Kaposi sarcoma, also known as KS. Kaposi sarcoma only comes out, and it's a tumor that only comes out with someone who is HIV positive. Kaposi sarcoma is heralding full-blown AIDS. Not a good sign. And you could see sarcoma. Oma means tumor. Sarc means fleshy tissue. SLE, systemic lupus erythematosus. We'll talk more about that in other chapters, especially regarding immunology. But this is your classic rash. It's called a malar rash, but it's the least of this poor woman's problems. SLE is an autoimmune disease. It means that the immune system attacks auto, which is yourself, and that's never a good thing. And the only thing we can do with these patients is immunocompromise them or lower their immune system so it won't attack. But then at the same time, you're opening the door to the patient getting sick. Enzyme studies, don't need to know that. EKG, ECG, nice to know. Holter monitor, nice to know. Stress test. Oh, US, ultrasound. You need to know that. Ultrasound, also known as a Doppler study, right here. Ultra means above or beyond. Graphy. Let's you know what? Instead of me just talking, let's break it down. Ultra, sono. So let's look at it from the back to the front. Graphy means process of recording. Right? I'm just going to put a plus because it doesn't fit. Ultra means above or beyond. Sona means sound. So it's the process of recording beyond sound. So it's really safe. And that's why we use ultrasonography on mommies and expected mommies. And also we can also do that. We can also use ultrasonography to look at arteries and veins that could potentially get clogged. And here they're doing a Doppler study on the anterior portion of her neck, which surgeons and cardiologists call the dangerous portion of your neck because it has all the nice dangerous arteries and veins that could clog up your brain. Bone marrow, ELISA, nice to know. Oh, angioplasty. Plasty means, oopsies, what's going on? Plasty means the process of repair. Angio is your blood vessels. So this is tubal angioplasty, which Dr. Rashkin, who was the innovator of this in the 50s and 60s, he was the mentor of my mentor in cardiology. And I wish I got to meet the man, but he's the one who figured out stuff like this, tubal balloon angioplasty. So it was a way of kind of rotor-rootering out and opening up all the plaque and all the nastiness in there. And they open up with a balloon, and then when they remove the balloon, the lumen, which is like the passageway of the tube, gets bigger. And if it gets bigger, you can reduce your blood pressure, and it also reduces the amount of plaque and other garbage that's in there. ECG, we already went over, right? It's easy. Ooh, defibrillator. What's fibrillation? Now, fibrillation is when your heart doesn't beat in an ordinary, what do you call that? In a coordinated manner. And then we use this machine, a defibrillator or an AED, automated electronic defibrillator, to do what? It essentially, and here's one, it essentially zaps your heart to reset. That's like the easiest way to say it. Endarterectomy, ectomy means to cut, endo means within. So what are we doing? I'm cutting within, or I'm cutting out from within. And you could see here, dangerous triangle of the neck. They did an endarterectomy with an arteriography. So what they do? Ectomy, they remove the plaque, and they repaired it. Pharmacology, logi, study of drugs. So we have anticoagulants. Anti means against. Coag means clotting. So coagulation. So what am I doing? These are blood thinners. Antiarrhythmics. They're against, if you have an arrhythmia or a bad rhythm or a no rhythm, what does an anti-arrhythmic drug do? It puts you back on rhythm. Antihypertensive. You have high blood pressure. I'll give you something to decrease that blood pressure. One of the most common antihypertensive is a beta blocker, which is right here. You'll learn exactly what that means in your pharmacology class. So one little side note, the thing about cardiac medication, if you use it wrong, the funny part is it gives you cardiac problems, which is the irony of medicine. There's a lot of things of that nature. Diuretics, that's your water pill. That's a pill that will make you urinate, right? Statin lowers your cholesterols. And a thrombolytic, again, just like an anticoagulant, they will dissolve blood clots. Okay. So they work together with blood thinners, but sometimes there's really bad side effects. Antiviral against virus, and an immunosuppressant. It is a drug that will do what? Suppress your immune system. Because remember we talked about that patient with an autoimmune problem with the SLE. We would give them corticosteroids, which is an immunosuppressant. It tells the immune system, hey, you lower your defenses a little. But the problem is when you lower your defenses, some bad pathogens could get through. But again, when you're dealing with medicine, you're always dealing with cause and effect, and always dealing what's best for our patient. So we're always making these hard decisions. Now, at the very end, which we'll be talking about later, but not right now, you could see, and you could go over, there's some case studies that you could look over for now, but we won't be touching those until like week 4. But just know that they exist. And maybe I'll put something out there for the discussion to maybe that you can look at it. But definitely week 4, week 5, we're going to be doing these case studies weekly, okay, where you're going to be designing your own quizzes. All righty, lady and gentlemen, do you have anything, any questions, comments? Because other than that, that's week 2, and that's all I got.
Thank you very much, Doc.
All right, if nothing else, I will process this recording and then I'll put it up. So you guys are free to go do your medical language lab and your discussion once I post it. All righty. So, ladies and gentlemen, thank you very much. I'm now signing off, and I will see you guys at least on this thing next week. But again, my commercial, I'm always talking about how if you're confused about something, give me a call, because I'm doing these quick Zoom sessions, only 15-20 minutes, and it's helped a lot of people. Instead of having, tutoring doesn't have to be like a whole full-blown hour. Sometimes it's just 15 minutes. Sometimes it's just 10 minutes. Okay. All righty. Have a good one. I am now signing off.